Is my screen visible?
Yes.
Someone has raised hand, it seems. Okay, so the answers will be A, B, C, D. So you can post your answers in the group. How much time for each question, Dr. Swati? 1 minute?
Maybe 15 seconds you can read out and then they start posting their answers in the chat box.
Okay.
And then we'll give out the answers in 15 seconds.
Okay. So all of the following are the features of quality in healthcare as per WHO, except so healthcare has to be safe, delivering healthcare that minimizes risk and harm. It has to be effective. It should reduce the delays, and it should be doctor-centric. Patient should obey what doctor advises.
So we have few people answering D. I think all of them have answered
all
D.
All of them answered D. Good. So, going, yes. Okay. So we go to the next question. Donabedian model for quality of healthcare does not contain structure, process, outcome. None of the above. Okay.
Somebody has answered C. Couple of them have answered D.
Okay. It is basically okay. Okay. This is every structure. Its structure includes infrastructure, equipment, manpower. Okay. Which has the processes in place, and that leads to outcomes. So this is the Donabedian model for quality of care. Okay, so go to the next question. Which of the following is feature of VAP in neonates? Increased FiO2 from baseline by 20%, increased PCO2 or ventilation demand, tracheal aspirates showing CFU 10:3 or more, A and B, and all of the above. Okay, this time people are thinking, it seems.
Some have answered, most have answered D. Someone has answered C, someone has answered E, but mostly D.
Yes, it is actually D. Tracheal aspirate showing CFU more than 10⁵ is considered as infection. Okay, up to less than 10⁵ is considered just colonization. So that has to be considered. What is XDR bacteria? They are acquired non-susceptibility to at least one agent in 3 or more antimicrobial categories, at least 2 drugs, any category, at least one agent in all but 2 or fewer antimicrobial categories, or resistant to 3 drugs.
Someone says D, someone says C, someone says A. So they are all over the place.
Okay, but majority are saying C, and I'm happy.
Majority are saying C.
I'm happy. So we are now at the age of not MDR but XDR, wherein the microbials, the bacteria are resistant to almost all the categories except 1 or 2, which are now left. So we please preserve those. So I appeal all to be the stewards for antimicrobials which are left, whatever are left. Okay. So no, this is not a mathematical question. Okay. Nosocomial pneumonia is VAP. Is it true or false, or is it something else? I don't know whether people are answering.
Someone B. your slideshow has ended, but some people have answered B.
No, actually it is, remember, nosocomial pneumonia is any pneumonia in hospital, okay, after coming to hospital, which was not there in incubation at the time of admission. So, hospital-acquired pneumonias and ventilator-associated pneumonia are two parts of nosocomial pneumonia itself. So, majority of us are actually coming up with VAP, which is 90%, and the HAP, hospital-acquired pneumonia, in non-ventilated cases, they are only 10% of the cases of total nosocomial pneumonias. Okay, please. Thank you.
Okay, so that's the end of the MCQ session and the end for today's FEAT session. Thank you so much. All of us will meet again next Wednesday at 8 o'clock. Thank you and good night.
Good night.
Good night.